Thank you for joining us to learn more about the first ever Gowanus Community Health Survey that we're very excited about. I know some of you are new to the work of Voice of Gowanus, so I wanted to let you know a little bit about us. We are the only 100% volunteer-run grassroots community environmental group dedicated to the cleanup of the legacy pollution in and around the Gowanus Canal, which continues to be a threat to public health and our environment. Some of our members were instrumental in the local movement to get the Gowanus Canal listed as a federal Superfund site, and our area continues to face really unique challenges due to the decades of industrial activities that left behind a tremendous amount of legacy pollution, and because this is a natural wetland and drainage area located in FEMA Flood Zone A. Over the years, Voice of Gowanus has been one of the few voices of accountability. We stood up for the community to make sure everyone could be heard during the rezoning process. We flagged serious environmental impact issues so that no elected could say later on, we didn't know. We filed an investigation demand with the EPA Inspector General that led to findings of major cost overruns and delays. And we funded the independent analysis of state data that uncovered elevated levels of the dangerous toxicant TCE at the Royal Palms Shuffleboard Club, which has led to the ongoing soil vapor intrusion study being done by the New York State Department of Environmental Conservation. In addition to that activism, we have also engaged in street theater and protest, collaborated with Powerhouse Arts on documentary screenings and the unveiling of Jeff Geip's Mucky the Whale statue, brought Yola Tango to public records, supported the local musical The Gowanus Fish Queen, and hosted many meet and greets and happy hours and fostered punk music activism whenever possible. So please follow us, reach out to us, and join us. Let's see, we are going to be joined tonight, we think, by Assemblymember Joanne Simon. I think she will be joining us soon, but I think she's not quite ready to speak right now. So we will come back to that when she is ready. But we wanted you to know that we did invite all of our local electeds to address the community this evening. Assemblymember Simon, we expect to join us shortly. Voice of Gowanus met with Congressman Dan Goldman earlier today to give him a tour of the most toxic site in our area, which is the former Citizens Gasworks site. And he asked us to pass along that he is engaged and scrutinizing the situation here in Gowanus to see how he can continue to support the health and safety of our community. And you can be sure that we will hold him to that. Councilmember Shahana Hanif was unable to join, but her chief of staff confirmed that a staffer is in attendance tonight, and State Senator Gennardis did not respond to our invitation. We'd like to start by just explaining some of the rationale for the health survey and why we launched this initiative. As I mentioned before, the New York State Department of Environmental Conservation is conducting a multi-year soil vapor intrusion study, which is looking at toxicants in the ground that vaporize and can come up through cracks in building foundations. Over the last 3 heating seasons, they've attempted to test more than 1,600 buildings in our area. And you can see on this slide on the right is a map of that investigation area. And that study is ongoing. But over the 2 years where they've had results, they have had to install remediation systems in over 10% of the buildings tested. Unfortunately, they've not been able to gain access to the vast majority of the buildings that they would like to study, but they have found elevated toxicants in our public schools, in our homes, in our places of worship. And this is, of course, extremely concerning. And so that is part of what led us to try to develop a first ever health survey for the community to try to understand what's going on with people in our area and how is this pollution impacting people's lives. I just got word that Assemblymember Simon is ready to say a few words. And so I wanted to introduce Assemblymember Simon. She's been an engaged advocate and vocal partner when it comes to environmental health impacts here in Gowanus, most recently joining forces with Congressman Dan Goldman to call out our state agencies for their failure to protect the community's health and safety. In a January letter to the Department of Environmental Conservation, Ms. Simon minced no words in writing, quote, "I am appalled at the twists, turns, and lengthy delays to cleaning up this site. I am offended by the apparent acquiescence of the agency to pollute our national grid. It fairly boggles the mind." And she was speaking about the Citizens Gas Works site, which is pictured to the left on the slide that's up on the screen right now. So Voice of Gowanus is very pleased to welcome Assemblymember Joanne Simon.
So hi, everybody. This is Assemblymember Joanne Simon. I'm sitting outside of a building in Albany that I'm supposed to be going to. And we've had just a very busy day, so I apologize for being a little late joining you. But I wanted to thank Voice of Gowanus for all the work they're doing. I'm very interested in learning more about the survey and the results of the survey. And I know that my staff is there joining you. And so they will come back to me. I have a couple of other things I have to do this evening, but I wanted to stop by and wish you well and see I'm saying hello to somebody, and really hope to hear some great things from this endeavor that you've been engaging in, and to continue to work closely with Voice of Gowanus and all of the stakeholders in this area. So thank you again very much. Thank you for your patience. Thank you for letting me in late, and have a great evening.
Thank you very much, Assembly.
Thank you.
We appreciate your engagement. So now we're going to turn to our main guest of the evening, and that is Dr. Judith Zelikoff, who is a tenured full professor at New York University Grossman School of Medicine. Her research is focused in the areas of toxicology and environmental and public health. She has more than 30 years of experience assessing the toxicology of inhaled single contaminants and complex mixtures, including metals, nanoparticles, and gaseous and particulate air pollutants. Her early work in inhalation toxicology focused on the effects of inhaled air pollutants on the pulmonary immune response in the deep lung. In addition to her extensive laboratory work, Dr. Zelikoff has also carried out numerous exposure assessment studies investigating pollutants and exposure pathways such as air, soil, and water, and the relationship with health outcomes in underserved populations, including in Sunset Park and North Brooklyn. She has 200 some published papers in the areas of toxicology and environmental health, and has written roughly 50 book chapters in the same areas. Dr. Zelikoff's other scientific specialty is in community outreach and engagement, and that is, of course, one of the reasons why Voice of Gowanus is so excited to collaborate with her on the first ever Gowanus Community Health Survey. So this evening, we will discuss how her work brings awareness and understanding of environmental injustice, builds community capacity, and disseminates information to underserved and environmentally impacted communities. Welcome, Dr. Judy. Thank you for joining us.
Thank you. Have to turn off my mute. So thank you very much. And it's my pleasure to be here. And I realized that when Jack said I've been busy longer than 30 years, I wondered, that's a long time. But I have learned and grown so much in the areas of toxicology. Initially, my work was in laboratory research, and I still continue that now, but I found a new love, and that is community work, because I can actually apply my science and my basis and my knowledge to people who really need to understand, because awareness brings action. And so I'm very happy to be here. I'm very happy to be part of this town hall. I've been working with Voices of Gowanus for about 2 years. I was based off campus for NYU Medical School in Sterling Forest, New York. And in 2018, they brought us to the city to be on First Avenue. And we have our laboratories and our community work is based there. as I went there, I met Steve Marcus, who wrote to me or was writing to some people who could help. And I, being the community engagement director, I said, I can help. Let's help.
Well,
And
that's great, Dr. Judy. I would love if we could maybe start by hearing a little bit about your prior work with community health surveys, because I know you've collaborated with a couple of other communities, even in our area.
sure,
What is a community health survey, and could you speak a little bit about that work you've done in the past?
sure. One of the first things to actually do when we work with communities, and we've worked with North Brooklyn neighbors for about, well, since 2018, we worked with Newhart, we worked with Newtown Creek Alliance. So we've worked with many people, many groups in Brooklyn. And one of the first things when we come in is we say, we need to have a survey. The survey establishes, it's called a needs assessment survey. And when you do a survey, you find out everything from health to the concerns of the community. And that's what we want to know. We want to know, we don't come in as an academic group and say, okay, we got you covered. No, we come in and we say, how can we help? What can we do? What resources can we provide? So starting with the survey is the first place. And as I said, we've been working with North Brooklyn neighbors for a very long time. Nicole, who is one of the facilitators of this town hall, was my graduate student and got a master's with her work on surveys in North Brooklyn. So what do we hope to gain from that? So we get the information, the quantitative information that is kept anonymously. No one ever sees it except the people who are collecting the survey and sending it back. It's housed in a locked drawer in my locked office, and it's anonymous. We don't ask your name, or we just want to know. So why are surveys important? Well, as Jack said, this is the first one happening here. Many surveys come in, and we try to get as many people as possible. Why? Because the purpose of a survey is to reflect the community's viewpoints, their concerns, their health issues. And we did all that with the other Brooklyn communities. And from that, you can move on to do other things. People wanted to know, what is my exposure? So we've moved on to do a collection of urine, collection of blood in other communities. But the survey is the first place to start. And from that data, from those data that come through, we learn a lot. And we then act as your advocates and make sure that the community gets back this data, all analyzed and all interpreted, and that can be shared with whomever you like. But it consolidates all the data from all of your voices. And that's what we want to hear, and that's what you need to know.
Okay, thanks, Dr. Judy. So, when people think about Gowanus, they often associate the pollution with the Gowanus Canal, which is, of course, a notoriously polluted body of water. But much of the pollution in the water actually comes from the deeply contaminated land that's around the canal. And in particular, there are three of the most toxic kinds of sites located in Gowanus: former manufactured gas plant sites, or MGPs, where coal was burned to create gas for over a century. So this process soaked the land in a carcinogenic byproduct called coal tar, alongside other industrial chemicals and contaminants. So, knowing that there's so much pollution in the land, what should people know about living on or near contaminated land?
Well, they should know that, as someone mentioned previously, that volatile organic chemicals, which are all throughout your house, and they are gaseous pollutants. They come from, if you don't have natural wood and you have wood, artificial wood, they off gas, If you open your closet or your cupboard underneath your sink, you have off-gassing of volatile organic chemicals. So there are things that you can do, and there are chemicals that you actually need to avoid. And so, for example, volatile organic chemicals, they come from the industry. You know, in reading the history of the Gowanus, because I live in New Jersey, and so Gowanus to me was a foreign state. And in reading about it, I was aghast, and that it took so long to be called a Superfund or named on the national priorities list to be a Superfund site. So from the toxic contaminants that you're talking about, or did talk about, Jack, we have many things. VOCs that I just mentioned, what they are, where they are. TCE, which was used a lot in degreasing, and we call them PAHs. They are polycyclic aromatic hydrocarbons. And again, these are all gases. And chromium, which is a heavy metal and exists in several forms. So you have to, one of the forms is not carcinogenic, another form is. So let me just say in general, because you can all see the slide, that there are a number of things that goes into making a chemical toxic or carcinogenic or cancer causing. And that is the length and duration of your exposure, the dose that you are exposed to, the method of exposure. You can be exposed through inhalation, you can be exposed through dermal, through the skin, you can be exposed through ingestion, eating contaminated foods that are grown in contaminated soils. So when you see some of these health effects, there are caveats to them. It has to be long enough, high enough concentration, and to bring about some of these very serious chronic illnesses.
And so, when we look at some of these things like TCE or benzene that's in BTEX or chromium, all of those things have been found in Gowanus, and the Department of Environmental Conservation, the Department of Health have declared multiple sites here a threat to human health and the environment. So people are understandably concerned about exposure. How can people become exposed to these toxicants? Are there specific odors people should be concerned about? Are there any other signs or symptoms of exposure to look out for?
So not all contaminants have an odor. Many deadly things, things that can affect morbidity, meaning illnesses, or mortality, meaning life, do not have an odor. And many things do. So anything that smells unusual to you, or like rotten eggs, or formaldehyde, or anything that smells like that, you really have to report that immediately, because once you can smell something, it can be injurious to your health. And how do you know? Well, a lot of the chemicals, by the way, BTEX, which Jack mentioned, is benzene, toluene, ethylbenzene, and xylene. And benzene is a known carcinogenic, leukemogenic, meaning causing leukemia, agent that has been confirmed and set by the federal agencies as a #1 human carcinogen. The others from the BTEX are deemed possible human carcinogens, but by themselves and on their own, low levels will give you things like headaches, and I'm talking about all the chemicals that are here. Will give you headaches, eye irritation, nose irritation, and these are small doses and acute, meaning single exposure. And so if you smell something, or even if you don't, but your eyes start to run and your nose starts to run and you have this pounding headache, you are being exposed to something by inhalation. Now, if you're on the site, you can, or children, or anywhere near, and there's contaminated soil, then you can be exposed through dermal. And if you're growing plants, gardening, and you're eating those herbs, you can be exposed by ingestion. But not everyone exposed gets sick. It depends on a lot of parameters as well as your own genetics. And that's something I like to point out. And I think my dog is going to bark, so please excuse me. I'd like to point out is there are what we call vulnerable populations. And those populations consist of the elderly, with people with ongoing disease like cardiology, pulmonology, people with asthma, also children, pregnant women, okay? Certain ethnicities have genetic mutations which make them more susceptible to things. So if you are in the classification of one of the things that I've just discussed, you have to be even more careful because even lower doses of these chemicals can bring about illness.
Thank you, Dr. Judy. Well, I think that that really helps to speak to the rationale for why Voice of Gowanus has put this first ever community health survey together because we want to dig into these issues and understand them better. And so I wanted to ask, how this project in Gowanus first got started, and if you would maybe be open to introducing the team that you worked with so that they could speak a bit more about the design of the study and the experience of taking it.
Absolutely. So for this study, people from Voice of Gowanus had said to us, the people need a survey. The people need to know what others are experiencing. The regulators need to know how many people are experiencing things. And this happened about, we started talking about this, even though we've been with Voice Gowanus for over 2 years. We started talking about this in mid-2025. And I suggested that I have very good, very competent, more than competent students, graduate students, master students, who might be very interested in working on this. So I introduced Voice of Gowanus to Aramis Valverde, and I introduced Nicole Lacombe Gibbs. Both of Nicole was indeed my master student, and she did a survey for Newhart. And Aramis is now, after he gotten his degree in global public health and epidemiology, he's now in law school. So we decided as a team, we're going for it, and hence the survey. So Aramis?
Hi, thank you very much. So I think Nicole actually, if you could introduce the thing.
Absolutely, and thank you for the introduction. And I'm also going to say, if you have any questions, please feel free to put them in the Q&A now. We will get to them very shortly. But if you just want to note them down as we go along, we will answer them in a few minutes. So thank you to everybody who has submitted questions already as well. So please keep them coming. So to introduce our survey, the survey is hosted on a platform called Qualtrics. You may have heard of this before. It's an online survey platform, and it is designed to take about 15 minutes. It's a one-time commitment and is going to be completely anonymous. So everybody who is a former or current resident of the Greater Gowanus region, which you can see on the map on the screen as well, is eligible for the survey as long as they are between the ages of 18 and 85. So again, that is both current and former residents because we want to try and capture the data from as many people who may have been impacted by Gowanus as possible. And the survey is going to include questions on your basic demographics, your location, etc., as well as questions about your own experiences with your health and environmental concerns. So it's going to ask about some of the environmental experiences you may have had while living in the area. And most of these questions are just going to be checkbox responses, so it should be super quick and super helpful.
And with any survey like this, privacy is naturally a concern. So as to how we protect the community's information, the survey does not collect any identifying personal information. So we don't collect IP addresses, names, emails, or any other information that could be used to identify an individual. Results are only released on aggregate, which negates the possibility of inadvertent disclosure in areas with only a few residents. And we do not release individual responses at all. As for the aims and the goal of the survey, we hope to get a closer look at the relationships between health and sites of contamination. What the survey does is to surface patterns that may warrant further investigation, and it further serves to inform community priorities. Because of this, and because sufficient responses will enable proximity analyses, every response is vitally important and makes the data set tangibly stronger. And as for the analysis, it will be primarily descriptive, identifying patterns in reported health conditions, symptoms, and environmental experiences across the community. With sufficient responses, we can examine those metrics by factors like proximity to known contamination sites, duration of residence, and type of exposure reported. It's important to note that the survey isn't designed to prove causation between specific contaminants and specific health outcomes. That requires toxicological studies. This analysis will draw on the analytical framework from Nicole's Newhart study, which has served as a model for our approach. Nicole?
Okay, and then in terms of just thinking about why you might want to take this survey, we do promise it's a short one-time commitment, but this is something that Voice of Gowanus is doing to meet community requests, and we really want to make sure that there is a opportunity for residents to feel heard, especially for those who have not felt so in the past. And having the opportunity to contribute to a survey like this is going to give everybody in the community some really valuable data and information and insights that we hope will benefit the entire community. And so we really do appreciate the time and support for this work.
I'd like to just add something, and that is,
Absolutely.
oh, thank you, Nicole. That is to say that the community owns the data. The Voice of Gowanus and the community own the data, not NYU, not Nicole, not Aramis. You own the data, which means that there will be a report back. We'll encourage, and I'm sure that Voice of Gowanus will want the same thing. There'll be a report back, we call it, with all the data after it's interpreted, and it will be interpreted by Aramis and Nicole and myself. And that will put together themes, patterns, trends, and let you all know what you as a community are feeling, are thinking, are needing. And so that's very important that you know that these data are yours. And if you want to bring them to DEC, if you want to bring them to EPA, wherever you want to bring them, they are yours to do with. I will tell you that going on a legal front, you may have some difficulty with that. And Aramis could probably tell you more about that. I would also encourage that once the survey is done and we've helped to interpret the data, that Voice of Gowanus, we will suggest to them that whatever the people want, and the people, your community, you may want to go further with this. So it's a stepping stone, and it's breaking ground that will be very helpful for the EPA and the DEC when they're trying to make decisions. Thank you.
Okay, I think we're going to transition over to our community questions. So thank you to all of you who have submitted those. And I'm going to start by with our first one to you, Dr. Zelikoff. Since there is a school and a playground across the street from Site 3, should families be concerned about exposure?
Families should demand testing. There are air pollution monitors that should be put up. There's, if there's a basement, vapor intrusion, which is soil and groundwater contamination that comes up through the pores of the soil and can get into lower basements, etc., through cracks and pores and foundation. So if that were my children, I would demand, unless that's too strong of a word, but Jack told me to go for it, and that there be certain testing done before I would let my children go. Because as I said, some of the vulnerable populations include pregnant women and children.
Thank you, Dr. Zelikoff. I just want to introduce myself. I'm Miranda, and I'm a member of Voice of Gowanus, and I'm going to present some of the other questions that we have here. Is it safer inside or outside buildings?
Is that for me? Okay. Believe it or not, indoors is much higher risk for volatile organic chemicals. Now, people spend a great deal of time inside, although less than less than they maybe did at one point. But you spend around 70% of your time indoors. Now, why are the volatile organic chemicals like PAHs, polycyclic aromatic hydrocarbons? Why? Well, because not only are you getting 90% of all the air outside into your house, but within your house, I'm sure if you're like me, I have covering on my couch so the dog doesn't make it dirty. And that off gases, carpets off gas, cleaning products off gas, gas stove. So you're getting not only from a single source from outside, but you're getting sources from inside. And therefore, it's been known that you can have volatile organic chemicals 10 times what's outside. So it's a mix. So what do? You want to keep the windows open. One of the big things to get volatile organic chemicals out is to, if it's affordable and if you can get it, are to have HEPA filters with activated charcoal brought into your home. And not just a HEPA filter, you can buy them, but it has to have activated charcoal so the volatile organic chemicals can adsorb to the charcoal and come out.
That's great. Are there any other ways that people can protect themselves?
Yeah, so we didn't mention particulate matter, but particulate matter is up. It can come from the ground. Oh, sorry. My husband. I won't answer. Particulate matter can come from the ground up. Particulate matter is a core carbon particle that's extremely small. Imagine a hair, and imagine around a single hair, you can put 20 of these little particulate matter. Particulate matter is a known lung carcinogen. It also adsorbs gases. So you can have VOCs, or volatile organic chemicals, on the surface of the particle, and then you inhale it. So for vulnerable populations, you can go to air monitors that New York City has, and you can go online and you can find out what the concentration is, and you may want to stay inside. So it's not just the volatile organic chemicals or the VOCs you have to be concerned about, but also there's particulate matter. And those are called ambient particulate materials, and they come in different sizes and they deposit different places in the lungs. You can also test, I mentioned chromium. You can also test for metals. That's a simple blood test, but your doctor doesn't do it routinely, and he probably doesn't have the facilities to do it. So you ask him. There's also lead in Gowanus. So you can ask your doctor to recommend a laboratory that will measure metals in your blood. You can measure volatile organic chemicals by high-powered instrumentation that would be sent out. And you can measure that in the blood, formaldehyde, aldehyde, many of these things. And you can also measure how they break down in the urine. So you can look for these markers. And I, I'll stop there, Miranda.
Great, thank you. You mentioned earlier that if you smell something that you react to strongly, or if your eyes suddenly start running, then you should report it. And somebody had a question about where you should report that to.
Yeah. Well, I don't mean if you have a cold. And clearly, if your eyes are running because you're allergic to something. I'm saying if you smell something, or even if you don't, and your eyes are running, your nose is running, you have a headache, there's something going on. All right. I'm not sure I would call right away, but if it continues, for a couple hours, I think Voice of Gowanus might be able to answer that question better than myself. As I said, I live in New Jersey. We would call a health line here, but Jack or Martin, anyone want to add to that where you might call?
Yeah, I mean, absolutely. I mean, in Gowanus, obviously, the Department of Environmental Conservation is conducting these studies, and we do have the contact information for the commissioner, Amanda Lefton. There's also, of course, the Department of Health at both the city and the state level. So I think those would be the places that you would want to report this.
Thanks. Can we go back to soil vapor intrusion? There's a question about if it's a problem for people who live on higher floors, or less of a problem for people who live on higher floors. I guess somebody at the health department told this resident that the toxic air quality risk is much lower at a higher floor, and they wanted to get your thoughts on that.
Yeah, for the first time in a long time, I agree with him. No, sorry. Um, yes, they're right. So because let's just talk about VOCs and gases. They come from the soil and from the groundwater. So they come up to the lowest floor, the garage, the storm room downstairs. So being on a higher floor is definitely safer. And I agree with that. But there are, living on a higher floor, you are also potentially exposed to the particulate matter, the PM, the little mixture carbon particles that can be inhaled. They're, as I said, very, very, very tiny, and they can be inhaled through the lungs. So that is something that can affect higher areas because it moves up. And of course, then you have ozone, which is a part of an oxygen formation along with diesel and gasoline, and it forms into what we call ozone. And ozone can be lower to the ground. So in the case of what you're asking and what the question is, from the volatile organic chemicals, you are safer on the top floors.
Thank you, Dr. Judy. I wanted to jump in, Miranda, and just also tell people that on the prior question of where to report these things, Assemblymember Simon has been very responsive with her staff, and I would encourage people to report these types of incidents to their local elected officials because sometimes our agencies are not so quick to respond, but our elected officials are there to help navigate that bureaucracy. And whenever you're reporting these things, you can also always CC Voice of Gowanus so that we can track those efforts and try to provide accountability on that front as well.
I can provide the email for Amanda Lefton if you'd like. That's Amanda.Lefton, that's Lefton at dec.ny.gov.
You can see that on the screen here as well, down the bottom. For those of you who are asking, it's a little small, but yes.
I just wanted to also add, and just a short thing. The more people that fill out the survey, the more accurate our data is. Our data is plural. So it's really important that if you're serious about knowing what's really going on and providing the energy and the power to take this forward to regulators, etc., that this is going to really help. So please get your neighbors and your friends and everyone, because it adds to the power, as Aramis said, it adds to the power and the accuracy of the outcomes. Thank you.
Thank you for that addition. We have a couple of follow-up questions to what you were just speaking about with VOCs. So, namely, what about kind of VOC testing and trying to get that done? Is it too late for that? How do we kind of advocate with landlords potentially to get that done? And we did have a follow-up question about elevators acting as pneumatic tubes, drawing up VOCs to higher floors.
Wow, that's an interesting second part. So let's start with the first part. And since I have been in science for over 30 years, the memory. So we'll start with the first question. And that was about I'm sorry, VOCs and what, Nicole, specifically?
Yeah, so about VOCs and SVOCs and their testing for them, and
Okay.
if that is if it's a good time to do it now, how do you talk to your landlord about it?
Well, I think you might have, I think you should talk to your landlord about it, but I don't know what the response is going to be. But I will tell you from a scientific perspective, it's never too late. Okay. So volatile and semi-volatile organic chemicals can be tested through blood, and the metabolites, we call them, or the breakdown products of those chemicals can be found as markers in the urine. So urine and blood tests can see the markers. We call them parent compounds, and then their metabolites. So many, many markers in urine. Now comes the negative. The negative is these are done by very high instrumentation, which only certain laboratories can do. And I would estimate a guess that they're extremely costly. So I would definitely say it's not too late. If you feel that there are that you may be subject to exposure. Now remember, VOCs are volatile, which means they gas. So if you've been exposed in January and you're going to be going in June and you're not exposed to them anymore, or you've moved away, or you've done whatever, you probably wouldn't find them. So it's not too late if you feel like you've been exposed. Now, metals, you could test for lead, you can test for chromium. Those metals are very simple to test for. But again, the doctor or your physician or your healthcare professional will tell you where to go for those tests. And in New York and New Jersey, for children, blood lead levels are free. So under a certain age. So I think that's a really important thing, because not only is chromium found, but there's lots of lead and there's lots of mercury where you are. And lead, of course, can affect neurologically, and mercury, again, can affect you neurologically. So metals, what happens with metals, with mercury specifically, with high levels, is that you'll have shaking and you'll have constant headaches. And just an interesting point, if anybody remembers Alice in Wonderland, the Mad Hatter, the reason he was mad is that he always wore a top hat, and the felt was made with mercury. So made the Mad Hatter mad.
Thank you. And we had another question about the testing for VOCs and for
Okay.
particulate matter. Is it sufficient to protect the most vulnerable members of the community?
Absolutely. Absolutely. Older people usually have some underlying or ongoing other disease, type 2 diabetes. In the other community that I work with in New Jersey, very, very high levels or prevalence of type 2 diabetes, high levels of cardiovascular disease. Children are extremely vulnerable to things like asthma. And as I said, elder populations who have diabetes, who have asthma, who have cardiovascular, cardiopulmonary disease, they are much more vulnerable. Pregnant women, extremely vulnerable because things are not only affecting the mom, but the fetus acts like a sink. And so whatever can get through the placenta, like lead, actually is found in higher levels in the fetus and the neonate than it would be in the mom themselves. So it's definitely important. I remembered your second question about the elevator. I don't really feel comfortable in answering that question because I don't know the answer. I would say that, you know, if there's VOCs coming into the elevator, blowing in, that's definitely a confined space, and it's definitely not, I'd step out sooner rather than later. But I can't really answer that engineering-based question.
Sorry, go ahead, Miranda. I want to hear a little bit more from VOG members on some more of the toxic sites.
I guess you want a description of what the sites are in the neighborhood. Okay, so we have the three MGP sites, the Fulton site, the Citizen site, and the Metropolitan site. So those are the three manufactured gas plant sites, and then also many, many brownfields. I think DEC is the best place to go to for information about where those sites are. You can see a lot of maps on their website about that. There have been a lot of questions about proximity to the sites in terms of health. And maybe, Dr. Zelikoff, I can ask you for a little bit more information about proximity and how that might work.
Yeah. Thank you. The closer you are to a site, the more likely you are to have higher concentrations or greater exposures. And the further away, the less likely. Air particulates can travel miles, and you can be inhaling them. But again, the closer you live, there are many studies that have shown this. Our studies have shown it. We worked in New Jersey. We did toenail clippings to find out how much chromium was actually people were being exposed, and that's published. And we found that the closer the person was to the Superfund site, the higher the level of chromium in their toenails. And you may say, why toenails? Toenails grow very slowly, and just the top can show you the first 6 months. So it's something very important to do, and there are a lot of exposure things. that can be done to look at things. And coal tar, I see it popping up. Coal tar is definitely class 1 human carcinogen, and coal gas, which was made from the coal tar. But again, I just need to remind you as a scientist that just because something may be causing asthma or associated with asthma or chronic kidney disease, which many of these chemicals can, that doesn't mean you're going to get all these diseases, okay? It means that if you're exposed, you're at higher risk. Now, you may not be exposed, or you may be exposed short term. So remember again that it's duration of exposure, concentration of exposure. Of course, the higher the dose that you're going to be exposed to, the higher the risk, the higher the hazard. But please don't go home thinking that, oh my God, I'm gonna get all these diseases. I'm horrified. I'm horrified for my children. I think the first thing that's most important in town halls and in surveys is to bring the awareness to people, not to frighten you, not to over dramatize this, not to act out of irrational behavior, but to say, okay, now I know. Now I know what I could be dealing with. Now I know what's out there. Now I have to do something to help change it. And if you want to know whether you're exposed, go to your doctor, tell him you want your metals checked in your blood. You want your children's levels checked, okay? And, I would say to contact myself or Nicole, and perhaps we could, or even LabCorp maybe, can tell you where to go for the VOC measurements. I would suggest blood. People have more instrumentation in that area, and it would probably cost less.
Thanks, Dr. Judy. Yeah, it's really important. A lot of what Voice of Gowanus does is to try to educate the community because these issues are so complicated. And to speak to the proximity question, I mean, Miranda spoke to those 3 major polluted sites. There are over 100 known toxic sites in Gowanus, but those huge sites, the manufactured gas plant sites, have these vast underground plumes of toxic contamination. And that's one of the things that we've been pushing for is a plume map, so that the agencies understand where are the meets and bounds of these giant plumes of contamination because the groundwater is polluted. And because this is a drainage area, it goes back to what I said at the beginning. We have a unique circumstance in Gowanus where all of the water, and if you think about climate change, increased rainfall, the water levels pushing up, right? That's moving that contamination around our neighborhood, as is storm surge. So, when we have flooding in this community, it's not just water, right? It's these contaminants that are being pushed around, and that's also happening underneath the ground, moving contamination underneath buildings that maybe never were industrial sites. So that's why we have to be vigilant as a community, and this health survey is a really important step for us to find out more about what people are experiencing. So please take a minute to scan the QR code and take the survey. And as a final question for you, Dr. Judy, we wanted to ask, what positive outcomes have you seen for other communities that have done this kind of initiative in the past? I think that might provide another rationale for people to take the time and effort, to fill out the survey and share their information. So what have you seen come from this type of?
Well, I will say a short one, but I think Nicole also has a lot to offer from the Newhart studies. I will tell you, I work with Indigenous people and from New York State and New Jersey. And we started with a very long survey, which is what they wanted, because no one had ever done anything like this for them. The survey got picked up by all the newscaster, the results of the survey, all by the newscasters on social media. And also with that, the community said, well, we want more. Are we exposed? So and we have a very large grant from NIH, and that's where more work can be done by writing and getting grants. And so we did blood and urine. It's out there in publications. They talk to the EPA on a regular basis with these data. We've done soil collections, we've done air monitoring, we've done all kinds of things. So the survey itself leads to more information that backs up what you already know, probably. I don't feel well. Why is there a cluster of people living on a given street that all seem to have some type of cancer, or they have cancers that are so uncommon? So this actually puts hard numbers and hard data behind it to say, wow, of the 300 people we surveyed, 150 say they have thyroid cancer or have had thyroid cancer. Or out of 200 people, we have 75 people saying they've had stomach cancer. That's pretty rare. Okay, so this puts hard numbers behind what you already are thinking. And that's what people need to see. And they need to see it from scientists.
Thanks, Dr. Judy. So please let your friends and family, neighbors, and colleagues know about the Gowanus Community Health Survey. If you have access to an organization that sends out a newsletter or that's active on social media, please share about the study and help Voice of Gowanus spread the word. Please also follow Voice of Gowanus, join our email list, consider supporting our work with a tax-deductible donation. And we want to just really thank Dr. Judy and Aramis and Nicole for all of the tremendous work they've done to put this initiative together. We are so grateful for your partnership, and we will continue to work and get the word out about this community health survey.